I think some of the biggest challenges are dealing with some of the restrictions that are just coming along with the battle in the medical profession right now, with other allied healthcare professionals, and trying to continue to show our worth and our wealth to the healthcare profession. We just need to do a better job of promoting ourselves politically, publicly, so that when it comes to a new law being passed or something that may be restricting to our access, that we're able to put up the resistance to make sure that we continue to keep our access to patients and those things, and they have access to us.
Challenges I see is the mental health aspect of things is really starting to play a big role across athletics. You might not see it mostly in football and basketball, but you see it in a lot of other sports, especially women's sports.
I think one of the biggest challenges is just the lack of life balance. I think that athletics has become something that is just such a big animal that the demands on the student athlete are so high, which then reflect onto our job descriptions and the time that we spend with the athletes. And so I think we concentrate a lot on the health of the student athlete, the mental health of the student athlete, but we sometimes forget about those aspects of the athletic trainer and how they endure during really long seasons, long working hours, kind of being at the mercy of teams and their schedules. So I think burnout is definitely an issue in our field, and I hope to find different ways that people can maintain a pretty healthy life balance, all the while doing everything that they need to within their job and being able to be an effective athletic trainer.
The biggest challenge is certainly funding. I think with the specialty of sports and training and everything that goes into it, institutions are having a tough time funding that to keep up with the growing trend that is occurring. And staffing would be the other part. Athletics participation is growing tremendously, but funding and getting the staffs up, keeping the staffing up is not catching up as fast.
We have a lot of responsibility, but we don't have the authority sometimes to tell a kid to do this, and if they don't do it, then how do you punish or hold the kid responsible without your coach's backing? I think that's a difficult aspect. I also think kids these days want passive treatment. They want to come in, they want to lay on the table, and they want you to make them better. And I think there's a place for that to a certain extent, but then you can't want to make the athlete more healthy than he wants to make himself or she.